Hi, my name's John. I'm 63. I've just had cataract surgery yesterday, and I just thought I'd put this on just to reassure people because I was quite worried before I had this operation. And anyway, I'll just quickly run through what happens. So it's just over 3 weeks from first referral. I had to go down to Manchester to Spa Medica. It's a private clinic that does NHS work. They're very good. Staff, absolutely brilliant, friendly, put you at ease. Can't recommend them enough. So anyway, your first appointment is for an eye test. Run through some other tests with you, and they determine if you're suitable first of all, whether it's one eye, two eyes, and so on. So that was just over a fortnight ago. You do have to isolate for COVID-19 for 2 weeks before the procedure. So did that, and I went in yesterday morning. My appointment was 10 to 9. So I had, first of all, they put your eye drops in. They put a little pellet underneath your eyelid. You can't feel anything. They put a couple of drops in that dilates the pupil and so on. And then you have a wait then of around about an hour in the waiting room. After that, you're taken into another little room. You get some more eye drops, which is the anaesthetic. The surgeon runs through the procedure with you, answers any questions, puts you very much at ease, and then you're through then to the operating room. You lie on a bed, they put a sheet over you, they cover. I had my right eye done, so the left side of my face was completely covered. You're all covered basically, except for this area around your eye. They ask you to keep the eyes open, and they put a little clamp on the eye that's been operated on, just to stop you from blinking. But you feel as if you're still blinking because it's a natural thing to blink. So you're actually blinking, but this little clamp actually holds the skin of your eyelids away from what the surgeon's doing. So that was fine. That worried me a little bit about blinking, but it's absolutely fine. The next thing you know is a bright light that comes across and over your eye. So that's all you can see basically, is this bright light. Now they drop like water basically. It's not cold or anything, it's fine, and that irrigates your eye. So the first thing you sort of sense is wetness, and a bit does drip down the side of your head. And it's like looking up through water or a kaleidoscope, and you just see different colours, and it's sort of kind of moving like a bit of that psychedelic. And then you just feel a little bit of pressure, and it's all it is I felt pressure in that eye as well, so he must have had his hands around sort of here kind of thing working. Not painful, just a little bit of pressure. It went red the vision went red at one time, so I don't know, maybe a little bit of maybe blood, I don't know, but certainly no pain. And then it's a kind of a sense of movement in your eye. Your vision is sort of like going in and out of focus maybe, and then you hear a humming, I believe that's the ultrasonic, the laser thing that breaks up the old cataract. That breaks it up, and they suck that out apparently. So that's gone, and then the surgeon just tells you, "Oh, just finishing now," and he pops the new lens in, and you don't feel it. You don't feel anything at all. You don't see anything except this bright light, little bits of movement. That's all you see. And I am not joking. It is 3, maybe 4 minutes, but more likely 3 minutes. You're actually on the operating table once he starts. It's 3 minutes. It's absolutely fantastic. It's over before you even, have time to get worried or anything. And then they put this plastic cover on that goes over your eye, and that's just to protect your eye from you touching it, basically. So you wear that for the first day, and you sleep in that overnight. The following morning, take that off. They give you a spare one of these, a new one, all sterile, and you've got to put that on each night. You will need to get some surgical tape beforehand. Just you can buy that at any chemist or so on. So surgical tape just to hold that on at night. They don't give you that. So you wear this for a week when you're sleeping, just so you don't roll over and put excess pressure on your eye. They also give you a little bottle of drops, and you put one 4 times a day. That's for 2 weeks. They give you some more drops in case you have a sort of dry eye feeling or a scratchy, itchy eye. Anytime you just pop one of these in. And sterile pads they give you. This is when you wake up in the mornings. Sometimes apparently you feel a bit gummy around your eye, a bit sticky. So you boil some water, put it in a cup or a bowl, let it cool down. Sterile pad, just damp it and wipe your eye like so, from the inside out, just to get that gumminess. They give you plenty of information, all about do's and don'ts and things like that. Right, so I walked out of the clinic around about 20 past 11, something like that. I was fine all the way home. Fine. I got a lift, obviously. So I was absolutely fine all the way home. When I got home, after about 2 hours, I think the anaesthetic started to wear off then. And what I found was it was a really sort of dull ache. I felt like I had maybe an eyelash in my eye. Obviously you've got your shield on, so you can't be tempted to touch it. But looking into any sort of light, very, very sensitive to light, hurting my eye. So I put some sunglasses on, and that helped, but still not enough. So what I did was I got a little bit of kitchen roll, basically. If you've got an eye patch, that's great, but I just wrapped some kitchen roll around underneath, between my glasses and that shield, just to give further protection from the light, and that worked to a degree. I went on a laptop and the screen was too bright for me, I couldn't do that. I could watch TV, but if you look away from the TV and then sharply back at the TV, that hurt. So that wasn't very nice, first night. So anyway, painkillers. I went on, I've got some painkillers. You can use whatever you want, whether it's paracetamol or whatever. Did they help? I'm not sure, to be honest. I'm not sure, but I took them anyway. So I went to bed, couldn't sleep for a few hours. I have a Kindle. I normally read before I go to sleep. I changed the colour on the screen to Scepter, which is a softer colour, and I turned the brightness right down. Managed a few pages, but still a little bit uncomfortable, so I left it. Drifted off after a couple of hours, and that's it. This morning, a little bit sticky, gummed up feeling on the eye. So my wife boiled some water and I took the patch off, and we did this shield. I took that off, and we did the washing of the eye, which easy enough. Still painful, even through. I stayed in bed for a while, and even though we had the curtains drawn, the light that's coming through the curtains was still a bit much. So there's me, sat in bed, feeling sorry for myself with my sunglasses on. So I thought, right, so I got myself up, I had a shower. You just got to be careful when you have a shower. They advise you to hold your head right the way back and sort of, you know, do your hair from your forehead backwards, rather than have everything dripping down. You're not supposed to get soap in it or excess water. So as soon as you get your face wet, dab it with a towel. Dab it, not rub. And then I put the drops in. Just started them little drops. Completely missed on the first go, but I got it on the second go. Half an hour after putting this drop in, the change is unbelievable. I can actually look at the light now at the window. If I look quickly at a bright light, still get a throb, but nothing like it was. So these drops, brilliant. 4 times a day. And that's where I'm up to now. I can manage to look out the window. And the vision, by the way, beforehand, it was like if I shut that eye. I've got a little bit of cataract in that one, so I'll be going back in a few weeks to have that one done. But this was by far the worst. Now, if I did that before, it was just like stood in maybe a steamy bathroom or something like that. All down the middle of my vision was completely blurred. Now, as I look out the window, the vision is, I would say, sort of 80%. But they do say it takes a couple of weeks, 2-3 weeks even, before your vision clears completely. But I can tell straight away that it's going to be fine, because everything's sharp, everything's more or less in focus. Absolutely brilliant. So I'm looking forward to, as time goes by over the next couple of weeks, to that improving. And then we'll get this other one done. But I just wanted to reassure everybody. I looked at videos on YouTube, and I could only find maybe people that's had it done months and months and months after the procedure. But I thought I'd just give you an heads up of what, as it goes by. I'll do another one tomorrow and keep you up to date of how we go on. If it keeps improving like this, I don't think I'll have any problems at all. And they have told me to to go back in 2 to 3 weeks to my optician, they will then sort out a date for my second operation, but I really need this done as quick as possible. So they have told me to, if everything's good after a week, go back to the optician, and if everything's okay, it's healing okay, then they will set this date for the next one. So that's it. So basically, don't be concerned, don't be overly concerned. They look after you down there. Everybody's friendly. They do put you at ease. If you've got any questions, don't put them off. Ask, and they'll explain everything to you. I mean, I wanted to know. I mean, afterwards, I shouldn't have to wear glasses for distance, but I'll still need reading glasses. So the one thing that was bothering me was if I'm driving, you've got your distance vision through the windscreen. What about if you then look down onto the clocks on the dashboard? And apparently, nobody's asked them that question yet. And there was a nurse that was there for years, and she can't remember anybody asking that question. So basically she said, I may need something like a varifocal where it's kind of clear at the top and a reading bit at the bottom, but she said, have a go, because nobody's ever complained about that problem, so it may be okay, I don't know. But if you've got anything that you want to know, don't be scared of asking them, because they're okay, they're not going to bite you. What else? I can't think of anything else at the moment. So that's it. So this is the morning after. I didn't have a shower last night. I didn't want to put anything at risk, and you know, you feel ratty after. So I'm up now. I'm showered. I've got my drops in, and feeling good. So, all right, I'll leave you now, and I'll be back tomorrow. Thanks. Bye.